Good day, I welcome you back. Dr. Scott, your online headache doc, the only doctor of any kind certified by both the American and International Boards of Commonsensical Medicine. Welcome to this week's episode of Relief at Last, what your doctor won't tell you about your migraines, your headaches, and your ongoing pain. Today we're going to discuss a topic that arose last week in my office, what is sometimes called rebound headaches. But a more appropriate term is medication dependency or medication overuse headaches and migraines. I want to read something to you that we provide to our patients here in my day-to-day practice. Medication dependency or medication overuse migraines and headaches. Medication dependency headaches and migraines can be caused by both over-the-counter and prescription headache and migraine medicines. Sadly, many headache and migraine medications can actually result in more frequent and more severe migraines and headaches over the course of time. Now listen to this. Other medications such as antidepressants, anti-anxiety medications, among others, can also result in medication dependency or medication overuse, migraines and headaches. Now, medication overuse and medication dependency, I want to define this because using medication for the appropriate purpose can be beneficial. But unfortunately, in our so-called healthcare system, and by the way, when it comes to migraine and headache care, we don't have a healthcare system. We have a symptom treatment system with each kind of doctor, specialist, chiropractor, therapist, each kind of healthcare provider simply treating or attempting to manage your migraine and headache symptoms, much of the time ignoring the real true cause. So, healthcare versus symptom treatment. And in medicine, as we all know, the primary mode of treatment for migraines and headaches is medication, a foreign, most of the time, man-made chemical that you're ingesting, with the most common side effects from your medication being increased headaches and migraines, and symptoms such as dizziness, lightheadedness, brain fog. All of these can be results from repeated and especially long-term use of your medication. Again, both medications for migraines and headaches, and other types of medication as well. Now, why is this? What causes overuse or dependency migraines and headaches? This is defined as increased frequency and increased severity of your migraine and headache symptoms that continues to intensify the longer that you depend and use these both over-the-counter and prescription medications. When we get migraine and headache symptoms, the blood vessels in our head dilate. They get really large and lax. And the intended purpose of headache and migraine medicine, whether that's prescription medicine, such as the triptans, for example, sumatriptan, rizatriptan, as well as some of the over-the-counter headache medicines, Excedrin, for example. Their intended purpose is to help constrict or to shrink those blood vessels back down. And with medication dependency, medication overuse, or rebound headaches, if you want to use the older terminology, is the medicine is taken in an attempt to constrict the blood vessels. However, as soon as that medicine wears off, the blood vessels immediately dilate again, resulting in the return of your migraine and headache symptoms. And the longer that you depend on these medications, the more often this will happen, and possibly the more severe your symptoms will get. So, what is the typical medical answer for these rebound type headaches due to medication dependency or medication overuse? All right, tell me how much common sense this is. If this medicine is causing rebound headaches or causing your headaches to return more frequently, let's try a different medication. And it may or may not help temporarily. But if it does provide some kind of temporary relief at best, before you know it, the same effect can happen. When the blood vessels constrict, they will dilate once again, resulting in your migraine and headache symptoms returning more frequently and more severely. And then let's try the next pill, the next shot. It doesn't exist. There is no magic pill, shot, potion. There's nothing chemical and foreign that you're going to ingest in your body that, number one, is going to address the cause of your migraine and headache symptoms. And number two, medicine, especially if you take it over an extended period of time, will likely have side effects. And again, common side effects of both prescription and over-the-counter medications are commonly more headaches and migraines, dizziness, lightheadedness, brain fog, among many, many others. So, the cause of your dependency headaches has to be identified and addressed. And if the cause is repeated long-term use of either over-the-counter, prescription, or both types of medicine, we need to find an alternative to these medications. The medications have two primary purposes. Number one, preventative. So there are pills, there are shots with the intended purpose of either helping to prevent your migraines from returning as often or to help prevent the migraines or headaches from being quite as severe. And then there are palliative medications, or medications that are simply designed to attempt to reduce or control your symptoms, manage your symptoms temporarily. However, our goal is not to give you temporary, short-term relief from your migraine and headache symptoms. We're looking for significant, proven, long-lasting improvement from your migraine and headache symptoms, and yes, in many cases, elimination of your migraine and headache symptoms. And there's one way and one way only to do that. If you don't know the real true cause of your migraine and headache symptoms, chances are you may never experience any significant and certainly not long-lasting relief, no matter what kind of treatment or therapy you try, and no matter what kind of doctor, specialist, or healthcare provider you choose to see. If you don't know what you're trying to fix, which is the true cause of your symptoms, you're never going to fix it. Stop focusing on temporarily treating and managing your symptoms and shift that focus first and foremost to pinpointing the real true cause. Then, and only then, can a personalized treatment plan be put into place that will actually address that cause once and for all. Commonsensical medicine. You are not having migraines. You are not having headaches. They do not continue to return time and time again because you haven't found the right drug to put in your system. So, what I wish for you is to live a happy, healthy, active lifestyle, free from the limitations that are currently imposed on you by your returning migraine and headache symptoms. I want clean, nutrient-rich blood flowing through your veins. Not a toxic chemical soup of man-made chemicals in a feeble and failing attempt to pretend that you're not feeling the migraine and headache symptoms that you are. Find and fix the real true cause. There is no other way. So in summary today, medication dependency or medication overuse migraines and headaches occur only in someone who already has had migraines and headaches that continues to take chemical medication, especially over an extended period of time, that is intended to temporarily constrict the blood vessels, however, results in the immediate dilation of the blood vessels, causing your migraines and headaches to return more frequently and more severely over the course of time. The solution? Consult a multi-specialty migraine and headache specialist that is not only trained specifically in migraine and headache disorders, but in the proper diagnosis of the cause of your migraine and headache symptoms, and, listen carefully, also is highly trained in the specific upper spinal disorders that commonly result in migraines and headaches. This is the challenge. This was the challenge for me. This is the challenge for many, if not most of you. Everybody is more than happy to treat or attempt to manage your migraine and headache symptoms with whatever kind of treatment or therapy it is they happen to provide. However, finding a specialist that will say, stop trying things out, hoping you're going to find some kind of long-lasting relief. And instead, let's focus first and foremost on pinpointing the real, true cause. This is how you're going to find significant, long-lasting relief from your headaches and migraines once and for all, and there is no other way. Please share this podcast with somebody you know, somebody you care about that continues to battle ongoing migraines, headaches of any type. Much of the time, this was the case with myself. We feel like we've tried everything. And we feel like we're stuck on this medical merry-go-round of trying things out and hoping somehow. Stop and focus on the cause. There is no other way. Thank you for listening. I'm Dr. Scott, your online headache doc, and those are the facts. And everything else, well, it's just another opinion. The information contained in this podcast is for informational purposes only and is not meant to substitute for your doctor or healthcare provider's advice or recommendations. It is based on Dr. Scott's personal experience battling debilitating migraines for years, as well as his more than 31 years in private practice, specializing exclusively in migraine, headache, and chronic pain disorders. Copyright 2024 by Milagros Media, LLC.